Healthcare crisis at the tri-state border. Emergency care struggles in Chittoor district. In the chilly embrace of a winter morning in 2023, a tragedy unfolded in Pulmonar, a small town in Chittoor district, Andhra Pradesh. Latha, a 21-year-old government employee, found herself in a dark place and attempted to take her own life. But her colleagues, driven by urgency and compassion, rushed her to the nearest government hospital, a daunting 45 kilometers away, hoping they weren't too late. However, the next day brought a harsh reality check. Despite their swift actions, the delay in receiving critical health care proved to be a significant hurdle. After half a day of treatment, Latha showed no signs of recovery, and the hospital staff's lack of confidence in her survival was disheartening. A ward boy suggested transferring her to a private hospital in Tirupati, 75 kilometers away, a move that would cost her family dearly. Her brother, Harish, recalls the anguish. "We spent 70,000 Indian rupees in just 2 days at the private hospital, only to hear the doctor say they had done everything possible, but my sister was still not improving." In a moment of desperation, they were advised to take Latha to the renowned Christian Medical College, CMC, hospital in Vellore, Tamil Nadu, another 110 kilometers away. Miraculously, she began to recover there, but the journey was long and costly, totaling 3 Indian rupees lakh. Harish reflects, "While we are grateful for her recovery, our faith in the healthcare system has been shattered." Latha's story is a stark reminder of the healthcare crisis faced by many in the Chittoor district, particularly those living in the villages between Chittoor and Kuppam. This region, located at the tri-state border of Andhra Pradesh, Tamil Nadu, and Karnataka, is in dire need of accessible emergency and critical healthcare services. The nearest government-run superspeciality hospital, Sri Venkateswara Institute of Medical Sciences, SVIMS, is a staggering 200 kilometers away. For those who can afford it, CMC Hospital is the preferred choice, but it is still over 116 kilometers from Kuppam and 40 kilometers from Chittoor. In Kuppam, the only medical college, PS Institute of Medical Sciences and Research, PESIMSR, offers emergency services but is often seen as a financial burden by the local population. Unlike government hospitals, PESIMSR charges fees from the moment a patient steps in, and in critical situations, they demand payment up front, often referring patients to hospitals in Bengaluru, which is nearly 120 kilometers away. Lakshmi Narayana, a journalist from Kuppam, shares a tragic incident. A man injured during a bull taming sport was rushed to PS Hospital, then transferred to Kolar, and ultimately to Bengaluru, where he was pronounced dead due to significant blood loss. The challenges don't end there. Many residents express frustration over the lack of available medical staff at PESIMSR, especially on weekends and holidays, forcing them to seek help from private medical practitioners, PMPs, or hospitals far away. In light of these alarming circumstances, the Apollo Hospitals Educational and Research Foundation, HERF, has highlighted the urgent need for a super speciality intervention in the district healthcare system. Their report revealed that in just 2 months, the district hospital referred over 500 trauma cases to higher medical institutions in Tirupati, Chennai, Vellore, or Bengaluru. The Kuppam Government Area Hospital, with its 350 beds, also refers 80% of emergency cases elsewhere. Even the government hospital in Bengaluru, strategically located near a national highway and an accident hotspot, is limited to providing first aid, often referring critical cases to CMC Hospital or SVIMS. The tragic reality is that many lives are lost during these critical transfers, as time is of the essence in emergencies. K. Dhanasekaran, chairman of the NGO Rural Organization for Poverty Eradication Services, ROPES, emphasizes the vital role CMC Hospital plays in providing emergency health care to the region. He recounts a case where a patient with a severe gynecological issue was treated without any charges, showcasing the hospital's commitment to helping those in need. Despite the challenges, CMC Hospital has become a beacon of hope for many families in Chittoor and Tirupati, offering world-class services at a fraction of the cost of corporate hospitals. However, The presence of PMPs complicates matters. Many of these practitioners, often from neighboring Tamil Nadu, contribute to the rising number of emergency cases by prescribing unnecessary medications, leading to complications that could have been avoided. Dr. D.T. Siddharani, the District Medical and Health Officer, acknowledges the menace posed by PMPs and emphasizes the need for a super-specialty hospital in Chittoor. She believes that the public's reliance on distant hospitals is a result of the lack of local facilities and the improved socioeconomic conditions that allow people to seek better healthcare options. Dagamala Prasida Rao, the Member of Parliament from Chittoor, is determined to change the narrative. He is actively pursuing proposals to establish advanced medical facilities, including a trauma care center and more dialysis centers, to address the pressing healthcare needs of the district. Yet, as families like Murugesh's continue to suffer the consequences of inadequate health care, the question remains, what will it take to ensure that no one is left behind in this critical battle for health and survival? Murugesh lost his brother in a tragic bike accident, and as he reflects on the harrowing journey to find help, he asks, what killed my brother? The accident, the ill-equipped community health center, or the fact that we are cast away here without good hospitals? For anyone grappling with suicidal thoughts or emotional distress, help is available. Please reach out to local support services or dial 100 for assistance.